to the Double Blonde Brokers podcast. With this podcast, our hope is that clients and friends alike can learn something. With each episode, we make light of the complexity of health insurance by offering tips, tricks, vocab lessons, and even sharing stories of our experiences as brokers. New episodes launch every Wednesday. So today we are so excited to welcome you to our very first episode of the Double Blonde Brokers podcast. Today we are really going to focus on what exactly is a health insurance broker and how we can possibly help you navigate your health insurance woes. We will also dip our toes into Medicare and take a look at what those first steps are that you need to know when you are starting Medicare, a little bit about the deadlines and things to look out for. So without further ado, here is our first episode. We hope you enjoy.
Many people don't really realize that there are people that do the type of work that we do, and they think that they have to figure this all out on their own. But there is help. So we're going to start off a little bit today in one of our hottest topics, which is Medicare.
Medicare.
Okay. What's the biggest comment you get from people when they go, "Oh, I need to talk to you about Medicare"? What would you say?
They are typically extremely overwhelmed, and usually the first thing is, I'm getting so much mail.
Yep. So much mail. And sometimes phone calls,
Yeah,
which is just like really annoying because that's totally illegal. You're not even supposed to be calling people.
yeah. As somebody told me the other day that they got a text message saying, this is a reminder for your appointment.
Oh,
You need to call and confirm your appointment. Didn't say a time, who it was, anything. And that was just like that bait and switch to get them to call.
right.
And, if the Medicare person reaches out, then they can talk to them. So that was their little bait and switch to
Oh,
get them going,
to get her to
which,
call.
of course, they thought, well, I don't have an appointment with anyone.
Right.
So it can be quite confusing and overwhelming and just endless mailers every single day.
And don't forget about our famous past quarterbacks that are out there
Oh, yes.
trying to tell everyone that they've got the answer. Here's who to call. And but a lot of times when you call those places, they're they're just a what we call a one-stop shop, right?
For sure.
They're going to just give you one answer. But we as brokers, we are representing all the major carriers. So we can do a lot of really great comparisons because what you're going to find is that it's really a big decision and it's based a lot on your personal health needs.
Yeah. I compared a lot to like buying a car,
Mm-hmm.
where if you're going to buy a car, it is such a pain to have to go down dealership row and go to
Yeah.
Honda and Kia and
Yeah.
all these different dealerships, and you only get one car, one point of view. Say you're looking for an SUV, each of those only have one.
Right.
But if you could go to a place that sold all of the different car manufacturers, how much easier that would make your car buying journey. You could literally set them side by side and compare.
Right. Which is what we're able to do as a health insurance broker. And the one thing about our mail, and you'll see all these the advertisements and the things that comes through, and it does make it super confusing, is what we call the alphabet soup, right?
Yeah.
Because whenever you're introduced to Medicare, you're introduced to all these different A, B, C, G, F, and how it all is like when I first studied this, because we really have to be certified every year, pass a lot of exams, all this stuff. I thought, oh, only somebody like a government could write something this complicated because it took a lot of people to come up with all this.
Yeah.
But it, we do have a way of explaining it so that you understand the most important alphabet pieces of the soup and what you have to have. And honestly, that is what hardly you don't, you're looking for that in the mail. You're looking for this one document to come that says, this is your, this is it. But everything is really mostly advertisement,
Mm-hmm.
for you to get to go with some company that they're going to tell you that their product is the best.
Right.
Whereas what we're really looking for something that says from the actual Social Security office, And many companies even use that very deceivingly in their names, like, this is your official Medicare, and it's not.
Yeah.
It really isn't. So, really trying to, it is very difficult to sort through it all. But we're hoping we're going to just start off a little bit to tell you that this is available to you. And maybe the very first step that you would take. What's the very first thing that you advise people to do when they're considering Medicare as far as the timing of all of it?
Yeah, so it's pretty important to start early. And the reason is we all know our government doesn't necessarily move the
It does
fastest.
not.
And a lot of people don't know that if you are already collecting Social Security before you turn 65, you actually automatically get your Medicare Part A and B started. They send you that right in the mail. Very little effort on your part. But if you're not, like a lot of people are still working up to 65 or they want to delay that Social Security, they actually have to contact Social Security and ask them to start their Medicare. It's like even though they're in the system, they have no clue that they're turning 65.
Mm-hmm.
So it's kind of different depending on who the person is and what they need. And that's kind of the most important thing. And that should probably be done 3 months before your 65th birthday so that they have plenty of time to get that going. If there's any hangups, any issues, you have that Medicare card in hand long before you actually turn 65 and need it.
And the interesting fact that a lot of people don't realize is whatever your birth month is. So if your birthday is June 5th, your Medicare is going to start June 1st, no matter. And people don't really realize that. The only exception to that rule is if your birthday is actually on the first of the month, like June 1st, your Medicare could start May 1st. They allow you.
It's like you get a whole month for free.
Whole month. Okay. But it can't really start. Typically, it's not going to start till the first of your birth month. So the way the rule is set up is that you have 3 months prior to your birthday month, and 3 months after your birthday month in order to do this enrolling process to where it gives you this timeliness situation. But we recommend, like Emily says, as sooner the better. I mean, why would you want to? You don't ever want to get caught in the thing where it takes a lot longer than what you think to get your card to get enrolled in something, and your other insurance possibly is ending, and this can't start.
Yeah, so. And I've had instances where people do kind of delay, and they just don't get that ball rolling soon enough. And oftentimes, even though there may be instances where it could be backdated, your prescription drug plan can't be backdated, your supplement can't be backdated. And so oftentimes they go without full coverage for, a month or so. Right. And nobody wants that.
Matter of fact, you just had that happen. Right?
I did.
To a client. Just maybe share that a little bit.
So I had a client, they actually met with me pretty early, but had a little bit of a hang up in getting their Part A and B started. Waited a little bit too long to really file that paperwork. And by the time they got their ID card, it was 1 month past when their Medicare was supposed to start. They were a February 1st effective date and didn't get the card until about March 2nd. And so they were going without a supplement, without drug plan, anything to help cover those benefits that original Medicare doesn't cover. And actually wound up in the hospital. The man needed a pacemaker put in. So pretty major surgery in the hospital 4 days and didn't have insurance set up properly. And so that's a really scary thing. And, his wife immediately is texting me, oh no, what did we do? Kind of a panic. And it's terrible when you have somebody call you in that situation.
Yeah. There's nothing you can do. The fortunate thing is he does at least have Medicare, which is going to give a lot of benefits, but the deductibles and percentages and things like that, weren't covered. So for today, we just kind of, and I guess just to say that, piggyback on that, it really is easy to go online and sign up for A and B. I actually have a document that I give to any of my potential clients, and they just walks them through. Even my husband was able to do it, although actually he's not that bad on computers. But sometimes people are afraid of that But you set up your Social Security account, they don't even really want to send you your Social Security statements anymore. They want you to get everything online anyway. So you might as well just get on board, get online, sign up. It's the quickest way to do it. It can take anywhere from like 3 weeks or more to get your actual Medicare card. And that's the basis. That's the first thing you got to have, because without Medicare card with A and B, you can't do anything else. So explaining Medicare is a huge conversation because everybody has personal needs. So after we help people get signed up, I guess the very next thing we do is just collect all their doctor information and their prescriptions, and then we are able to put that together and come up with the true explaining of Medicare. But for today, we're not going to do that. We just wanted to acquaint you with the very beginning of what to do. And if you would say one thing in when you're trying to advise people um, about this process and this selection of what they're going to do, just maybe in a short thing, why you think it's so important. Why is it so important that a person takes the time to really explore all of the options?
Yeah. Well, I think the biggest thing is Medicare is not a one size fits all. We have a lot of people come in and say, well, my sister did such and such. That's great. Your sister may be very happy with it, but your sister takes very different prescriptions, has different doctors,
Yes.
has different health situation than you do. And so her plan, while it works great for her, may not work great for you.
Right.
And that's kind of the biggest thing that we do, is making sure that your plan actually works for you in your situation.
Yeah, exactly. I find that people will tell me, well, whoever they golf with tells them, that this is the one you need to get, or my neighbor, this is the one you need to get. I just got to the point of starting, what have all of your friends and family told you about? What is it, the one that you've got to have? Let's just start there. All right.
Thanks so much for joining us today. We are so happy to have you here. If you liked what you heard or learned something new, then go ahead and give us a like and a follow. Also, you can write us a review or share us with a friend, and follow us on all social media platforms. We are at Double Blonde Brokers on Instagram, YouTube, and Facebook. You can also send us an email at doubleblondebrokers@gmail.com. if you have any suggestions of future episodes, questions, or would like to work with us as your brokers. Tune in next week, where we will discuss in greater detail Original Medicare Parts A and B, what it does cover, what it doesn't cover, and what exactly you're supposed to do about it. See you then!